Welcome, welcome, welcome. There are two questions that take up a lot of mental space in my brain. They've been taking space since the beginning of my career. And those two questions are, why is healthcare so broken? And how can we heal it? I'm constantly thinking about this. And a few weeks ago, when I got asked to speak to a group of 72 healthcare leaders, I thought, what can I bring to the table? How can I answer those two questions? What can I share with this important group of people that might help them, the staff they serve, and the patients they serve? And what I came up with is the one skill set that I know can contribute to the greatest amount of healing of our current healthcare system is the skill set of self management. This is the one skill set that will improve our leaders' outcomes, our staff's outcomes in healthcare, and the patients we serve. And I actually think it would help improve the outcomes of our community because when one person learns how to self manage their own health, they inspire everyone around them to change. So, today I want to talk about what is self management, what does it include, what does it look like, and what can we do? So, self management, I define it as all that a person does to manage their health and well being to live their life fully and productively as possible. And I propose that this skill set be just as important for our patients to learn as our staff and our leaders in healthcare. Why? Because we are all facing chronic disease. The bulk of what we see in outpatient clinics is chronic disease, which is 75% preventable based on what we do, think, and say, our health behaviors. And not only does chronic disease affect our patients, it's affecting our staff and leaders. If we can all get better at learning to self manage our own health and well being, the whole system will improve. So, what does self management look like? What are the skills involved? It involves learning to collect data from the most important place of all, yourself. So, you, our leaders, our staff, and our patients' ability to assess themselves, to assess their strengths, their opportunities, their weaknesses. I want to invite you to download the Whole Life Healing Assessment Wheel if you don't already have a way to assess your own health and well being. I give it away for free at karlacauldwell.com. And the 8 areas that this form assesses are finances, personal growth, movement, nutrition, relationships, managed stress, so the ability to manage stress, spirituality, and rest and sleep. These 8 areas are extremely intentional. These are 8 areas that when we manage them, we are able to prevent that 75% of chronic disease. It supports the health behaviors that promote health and well being. Okay, next, choice. So, with self management, it's important to have choice because the person who's going to be making the changes, we're relying on their motivation, their will. They are going to make these changes. What I find really interesting is that most of us in healthcare were not trained in this. We were trained in emergency care, symptom management, triaging, find it, fix it. We were not trained to prevent the bulk of disease, the disease that is caused by health behaviors. I know as a nurse, I wasn't trained. And when I'm working with healthcare staff, nurses will share they weren't either. Providers share the same thing. Sometimes our psychologists and social workers they're the most likely to have some of this training, but most of us were not trained in this area. And I'm bringing this up because we are used to, as clinicians, making the choice for our patient. We are used to telling them what they need to change, how they need to do it, sharing that education. And unfortunately, we end up in situations where we see that same patient over and over again. And many times they are not changing. And this causes so much frustration for our clinicians. It's contributing to burnout in our healthcare clinicians, frustration with our leaders. And our patients are not happy about it. They want to feel better. So let's get back to the self management skill set. Choice is incredibly important. Our patient, you, our leaders, everybody has 8,736 hours where you are left to manage your own health. I'm being very generous at allocating 24 hours goes to professional care. I know personally, I have only been to see a provider 2 hours out of this whole year. So I think I'm being generous. 24 hours given to professional care, 8,736 hours are left for self management for our patients, our staff, and our leaders. What we do during that time is critical because we know that we can prevent the bulk of dis-ease by what we do, think, and say. How we manage those 8,736 hours is extremely important. And this is why choice is such an important part of self management, because if I'm going to rely on what I'll do in my own time, I definitely need to have a choice. I'll be more motivated and more likely to follow through when I choose. So that self assessment is key, and then choosing what will I work on. Next is learning to set intentional actions. So moving from idea to action. Very, very common for when people are working on their health to say, "Oh, I need to eat better," or "I want to move more," or "I need to sleep more." That's an idea. We're not likely to follow through on ideas. So we need to train ourselves, our staff, our leaders, and our patients to move from idea to action by making that statement SMART, a SMART goal: specific, measurable, action oriented, realistic, and time sensitive. So, what that might look like is, instead of "I need to eat better," I might say, "I'm going to have a vegetable at each meal for the next 7 days." That's very specific, measurable. We'll know if I did it or not. It's time sensitive, it's actionable. Only I know if it's realistic. And I'm going to talk about that in a little bit. If the idea was "I need to sleep more," then what it might look like as a SMART goal is, "I will go to bed 30 minutes earlier during my work days." and specifying that normally I'm going to bed at 11, but I'm going to start going to bed at 10:30 for Monday through Friday. Again, specific, measurable action. It's time sensitive and realistic. Only the person setting the goal will know that. And I'm going to discuss that in just a little bit. Okay, so we self management, assessing, collecting data from the most important place of all. If you don't have a tool, I recommend you check out the Whole Life Healing Assessment Wheel. It's at karlacauldwell.com. Choice, making a choice on what am I going to prioritize? What am I going to work on? Setting an intentional action item by making sure it's a SMART goal. The next is anticipating risk and problem solving. What I find so fascinating about that anticipating risk is that research shows us that if we think about what could go wrong, because something probably will, and we problem solve ahead of time, we're more likely to follow through on our goals. And when you look at organizational health, so for many healthcare organizations, they've adopted the high reliability organization framework. And within that framework, to operate as a high reliability organization, one of those pillars is anticipating risk and creating solutions before the problems happen. So I want to share that with you because the more we start to connect the dots and understanding that these are different languages, but they're really the same action, we can not only improve our own health, the health of our patients, the health of our staff, the health of our leaders, we can improve the health of our organization. Okay, so we're anticipating risk. That means that if my goal is to have a vegetable at every meal, I'm going to think about what can go wrong. And I'm going to think about what I can do to solve. So, for example, I might think, okay, if I don't have vegetables on hand, I might fail at my goal. What can I do? Well, on Sunday, I can make sure that I have enough vegetables for every meal. And if I don't, I can get them at the store. I might anticipate that I forget my vegetable at home when I go to work. So, what can I do instead? Well, I know at my work's cafeteria, they usually have vegetables, and maybe there's a grocery store nearby that I could run over there and get them. Or I can plan ahead and take some vegetables to work and keep them in the fridge just in case. So that's how you think what might happen because something always does. I mean, think about it. Think about your life. This is very normal. Things don't go exactly as planned. So we think about these things ahead of time and we problem solve ahead of time. Okay, here's where we're going to talk about that realistic part of SMART goal setting. Confidence is an important, foundational, crucial part of self management. When it comes to changing your health behaviors, the health behaviors that contribute to the greatest health and well being, confidence is the strongest predictor of success. And I have to tell you that I have been working with staff and patients for a long time on this. And I also practice these principles. And one thing I know for sure is that it is human nature for us to be unrealistic. I see this all the time. Even though I know better, I do this. And whenever I start a new health group with staff or with patients, every single time, people set goals that are way out there, and we need to rein them back. So please know that this is normal. This is normal, and you have to coach yourself through it. So let's say I want to change my diet, and I want to go from I'm eating out fast food almost every meal, and I want to start making all my meals at home. So maybe I set a goal that I'm going to make Monday through Friday, I'm going to make meals at home. That is a really big jump. Going from fast food every day to making 5 homemade meals, that's a lot. And when we do that, it's likely that we're not going to follow through. We're going to run into some challenges, and that can feel really defeating, and we lose confidence. And remember, I said confidence is the strongest predictor of success. So we want to get used to coaching ourselves. And if you're coaching patients or other staff or healthcare leaders, you want to get used to coaching confidence levels. So when someone sets a goal, you want to ask them, how confident are you that you'll complete this goal on a scale of 1 to 10? 1 being not confident at all, to being 10 the most confident. If the person you're coaching, or if you're coaching yourself, is a 7 or above, that means you set a realistic goal. If you're below a 7, or you're coaching someone that's below a 7, you want to coach them to tweak their goal so that they can be a 7 confidence or above. If that is not reaching you or the person you're coaching, you can also ask in this way: what is something you can do in this next week to improve by 5%? That will help to get your mind thinking about the next step instead of the ultimate goal. This is really important because we have to train ourselves and those we coach that where we want to get to, there's easily 100 steps between where you are now and where you want to go. And in order to get there, we want to create goals to get to the next step, the next step, the next step, until we get to where we want to go. So we can ground ourselves by either using that on a scale of 1 to 10, how confident are you? And rewriting our goals so that we're a 7 or above. Or you can also ask someone, what action can you take to improve by 5% in this area? 5% or more. What I find, and I'm guilty of this too, is that people are like, no, but I want to do more. I'm ready. I'm excited. And that's awesome. That is so great. We just want to remind ourselves and those we're coaching that confidence is the strongest predictor of success. And the best way to become confident is by having a win. And it's okay. We know you want to accomplish more, but let's get to this next step. And then we can go to the next step and the next step. Okay. The last part of self management is accountability. This means that we are setting up a system to be accountable for our actions. And again, we want to coach ourselves and the person we're working with to pick accountability that makes sense for him or her. We are all different. So what accountability might look like is maybe I tell my spouse what I'm doing and I check in with them daily. Maybe I'm going to have an accountability partner that's my friend or my colleague. Maybe that doesn't make sense for me, but I'm going to set an alarm on my phone to check in with myself. The reason accountability is so important is because without it, we might set a goal, be really excited about it, and then life happens. And 2 weeks from now, we might ask ourselves or ask the person we're coaching, how did it go? And it's like, ooh, I forgot. or it didn't go well, right? Maybe it uh maybe there was a mishap and it didn't go well and you just forgot about it and gave up. So the accountability is really important because remember, we have to train our mind that things don't always go as planned. In fact, usually they don't. So when we have this accountability, we can check in, and if things aren't going well, we can change our plan. Can change our plan according to what may have happened. Okay? So self-management, self-assessment, having choice, picking what it is you want to work on to improve, intentional action through smart goal setting, testing confidence. Confidence is the strongest predictor of success, and accountability. So I'd like to give you a few examples. And if you're a part of my paid community, you get access to the worksheet that goes with self management. I also have it available on my Stand store. You're welcome to reach out to me if you have any questions. All right. So I want to give some examples of what this looks like for either a patient or staff member. And then I want to share an example of a healthcare leader who's doing self management and just how that affects the culture of where they work and their staff. So the first example is someone who wants to eat healthier. So they decide that what they're going to do is plan ahead. They have set the goal that on Sundays, I'm going to look at my schedule so that I can see what I have going on for work and for my family, and I can plan a meal that makes sense for that day, depending on how busy I am. So they look at their week on Sunday and they notice which days are really busy and hectic. They notice which days are lighter. And for the busy days, they might be planning, okay, I'm going to buy a bagged salad and a frozen meal, or I'm going to use my crock pot and just prep the ingredients the day before and put them in the crock pot so that the meal is ready when we get home. They might also, on the days that are less busy, they might choose to make a homemade meal. Now, depending on where this person's at, they might also choose to maybe there's a day that's really busy. It's not even, there's no like room for frozen meal or crock pot. They might choose, be intentional about, okay, we'll get takeout from this restaurant and we're going to choose these items to order because they're the healthier ones on the menu. Okay, so that's what that might look like. That is someone setting a goal to plan ahead and supporting their health and well-being by making choices that match how busy they are. So they're taking into account their life. Now, what would happen if this person didn't set this goal? So what that might look like, normal might look like they don't know what's coming ahead during the week. They buy a whole bunch of things from the grocery store, hope it works out. And on the days that they're busy, they might be so busy and not have time, and the whole family's hangry. So they might resort to going to fast food and just picking whatever's available and eating meals that they don't feel great about. That's what it looks like if they're not self managing. I want to share an example from the leader. And this one I came across a few weeks ago from a chief medical officer. I was asking the group I was talking to, what are some examples of how you use self management in your life? And what did your life look like before you did that? And how is it affecting your staff, your work environment, your patients? So one of the chief medical officers was excited to share that what he does is he has found that meditation is extremely helpful and he doesn't need that long. He said 10 minutes and I feel replenished. I feel better, I feel calmer, I think better, I'm more efficient, I'm better for my staff, I'm better for our patients. And he said, I've learned to prioritize it. I put it into my schedule, and it's equally important as every meeting I have, every patient I see. This 10 minutes is priority. He mentioned that the effect this is having is not only does he feel better and he shows up better for his staff and for his patients, but he was sharing that because he's open about what he's doing, he feels that many other staff are now giving themselves permission to do something similar. They don't all choose meditation. Someone might choose going on a walk or going outside, whatever helps him or her. So he said that this is contributing to a culture of safety to take care of themselves. He's also noticed that at his clinic, it just seems calmer. The staff feel calmer and less reactionary. He was mentioning that he feels this way because before, when he didn't protect his time, he was running from thing to thing, and he felt like that was the environment, that everyone was doing that. I just find this so it's not surprising, but it's really exciting to notice that a leader's actions matter. They set the tone for the group. They inspire and role model staff and patients to also self manage themselves. So, what are the next steps that I propose for you and for me so that we can work towards healing healthcare? I want to propose that you start with you. It is incredibly helpful when you yourself begin to manage your health and well being. Because when you do it for yourself, you begin to inspire everyone within your sphere of influence to do the same. It is incredibly powerful. And when you go through this yourself and you experience firsthand the different challenges that come up when we are learning to self manage ourselves and our health, and when you coach staff and patients, you'll bring that real time experience to the table. Not only will you get better at managing your own health, but you'll get better at coaching your staff and patients to get better. I really hope this was helpful. And if it was, please share this with your network. I am rooting for your success times 1,000. And I really welcome you to reach out to me if you have any questions, any ideas, any aha moments. We are better together. Thank you so much and have an incredible day.